Hello and welcome to the New Hampshire Insurance Department presentation on Chapter 143 of the New Hampshire Laws of 2024, creating an independent dispute resolution process for healthcare providers to use who are out of network and have a dispute with a health carrier about the fair value of services they've provided. I'm Alex Feldwebel. I'm the health reform instructor for the insurance department. And to my immediate right is Maureen Brooks. She's the life and health workflow coordinator. And then Michelle Heaton, she's the life and health director. And will be available to answer any questions that you may have. Look at our first slide. What we'll be covering today is an overview of the process with a discussion of some of the advantages of the New Hampshire option, the steps preceding the independent dispute resolution process, a review of some of the forms that we've developed, how to submit a dispute, and what to expect after submitting a dispute. Next slide. So Chapter 143 created new consumer protections against balance billing by out-of-network healthcare providers. Once that happened, there needed to be a mechanism for establishing the fair value of services provided. And what we're talking about is emergency services provided by out-of-network providers or out-of-network providers who are providing services at an in-network hospital. The same services as are covered by the No Surprises Act, the federal act. So what this law does is to establish a new state-level process called IDR, Independent Dispute Resolution, which operates as an alternative to the federal process. So healthcare providers have a choice whether they want to pursue the existing federal process or use this new state process. The state process is managed by the New Hampshire Insurance Department, but it involves the same entities that are certified to adjudicate disputes at the federal level. We have certified, I believe, about 6 such entities at the state level to adjudicate disputes. Next slide. There are a number of reasons why it might be advantageous to pursue the state process rather than the federal process. First of all, there's no administrative fee. Secondly, the process is faster. Some of the timelines are shorter, and it's simplified in ways to make it a faster process. Each party pays half of the IDR entity's fee rather than the loser paying the full fee. That's what happens at the federal level. When each party pays half, that kind of lowers the transaction costs and makes the decision about whether to pursue the process a little bit easier. If the health carrier loses the dispute, the health carrier's obligation to pay an additional amount is strictly enforced by the insurance department. At the federal level, there have been issues with enforcement, even when the provider has won a dispute. And we have an improved rule allowing for batching of multiple claims in a single dispute. Next slide. So let's talk about batching for a minute. That's a pretty important item because it makes it a lot more efficient to use the process if you're able to batch. A certified IDR entity can consider up to 25 qualified items or services that get batched jointly for a single fee. the batching fee is different from the fee for an individual dispute. It's somewhat higher, but you can adjudicate up to 25 items. If you have more than 25, then that can be batched as well. And there's a fixed tiered fee that applies for every additional 25 line items. The basic rule for batching is that it needs to involve the same two parties, the same provider and the same health carrier, and it needs to be within a 30-day period, all of the services that are being batched. And there are two basic principles for batching. It can be a number of services provided to the same patient, or it can be a bunch of identical or similar procedures that are provided to different patients, all within a 30-day period. So let's look at the steps leading up to the independent dispute resolution process. The first thing that happens is that an item or service is provided by an out-of-network provider, again, either emergency services or non-emergency services at an in-network hospital. The law requires the health carrier to make a payment within 30 days of the bill, of receiving the bill for the services. And once that is received, the provider has 30 days to request an open negotiation period. The open negotiation period is different from the federal process in that it only lasts 20 days. But it works the same way in that the open negotiation period must expire before you have the opportunity to request independent dispute resolution. One difference is that in the middle of the open negotiation period, the provider is required to file a response. So 10 days after getting the notice of open negotiation, the provider has to respond. The process is made easier by the development of specific forms that everyone uses. So we have, I think, 3 different forms that we use throughout this process. And following the process is just a matter of filling in the blanks. The first form is the notice of open negotiation, and it has a corresponding spreadsheet where one would list the services and the service codes for the services provided. There's a notice of IDR initiation, which is the actual instrument by which you initiate open negotiation. And then there's a notice of offer that gets made once it's determined that the dispute is eligible for IDR at the state level. Each party makes an offer. So how to submit a dispute? The one part you have to be careful about is that within 20 days of there's a 20-day open negotiation period, but the appeal, the notice of IDR initiation must be submitted within 4 business days of the expiration of that 20-day period. So there's a relatively small window that's important to act within at the end of the open negotiation period. That's when you submit the notice of IDR initiation. We've developed a portal, so you do it on the insurance department's website. We'll show you later what that looks like. And you simply upload the completed forms that we have developed for that process. The portal will ask you some basic identifying information, and then you just upload the forms. So once you've done that, what can you expect in terms of the process? Once you upload the initiation form, the insurance department has 5 business days to decide on eligibility for the state IDR process. The health carrier has 3 business days to respond to the notice of IDR initiation. Once the insurance department makes the determination that the dispute is eligible, then the parties have 3 business days to agree on their selection of the IDR entity they would like to have adjudicate. If they don't agree, then the department will randomly select one of the 6 to be the adjudicator. And it gets assigned to that entity. That entity then has just 3 days to do a conflict of interest check and submit a confirmation of no conflict of interest. And within 10 days of the initiation of independent dispute resolution, each party is expected to submit their notice of offer, and at that same time, their payment of 1/2 of the fee. If either party fails to submit their half of the fee, then a default judgment is entered against them. Then within 30 days of the very beginning of the process, the IDR entity makes its decision and issues a written final determination in which it picks one of the 2 offers. It's baseball style negotiation in that at that 10-day point, each party makes their offer and one of those is selected. So that's the mechanism and the sequence for this process. Why don't we try and see if we can take a look at one of the forms, maybe the notice of IDR initiation. So that's the notice of IDR initiation. It has instructions and some basic information that you fill out on the Word document. Which looks like that. So that's our home page. And we've added a button, it's labeled Independent Dispute Resolution. And just by clicking on that button, you get a fairly comprehensive description of the process, similar to the one I've just given you. And there are links for the portal. And at the bottom, there are links for all the forms that you will need or that you may need to pursue the process.
Along with a copy of the legislation and our proposed rules. And we should mention that we did recently kick off proposed rulemaking. So those rules are in the rulemaking process. And I believe, has the hearing been scheduled?
I don't think a hearing has been scheduled. Yes, it's still in process.
But they were just initiated, I think, within the last week. So you'll see them in the register. And if you have any comments, we'll be accepting them as part of the rulemaking process.
Can we take a look at the portal? Is that what you're? So this is the portal. So it's got some drop-down options for describing who you are and what type of submission you're making. And then I think at the bottom, after you fill out that basic information, is the button for uploading the files that you need to upload for the process.
One more thing that I don't think we really touched on yet is that this process is required for carriers that have fully insured plans. So if the provider selects the state process for fully insured plans, the carrier has to do that process. For self-funded plans, it's optional. And in order for that the state option to be available for self-funded plans, the self-funded plan has to opt in. So we will be maintaining a list of self-funded plans that have chosen to opt into the state process on our website. But as of today, I don't believe we've had any self-funded plans opt in right now. So for providers, that's one thing that you do need to be mindful of, is you need to figure out who the payer is and whether it's a self-funded plan or a fully insured plan. Because if it's a fully insured plan, then this process is available. If it's self-insured, unless the self-insured plan has opted in, then you would have to pursue the federal process, and that's the only process available for dispute resolution currently.
And most of the time, it'll be pretty straightforward whether it's a fully insured plan or self-funded plan. But if it's not, until our registry of fully insured plans is up and running on our website, you can call our consumer services unit and get the answer to whether it's a fully insured plan. And the number for consumer services is on our webpage for IDR. AJ, did we get any questions?
Leave it open for a few seconds. Anyone have any questions? Yes.
Thank you. Just for the record, my name is Ben Bradley. I'm the Vice President of State Government Relations for the New Hampshire Hospital Association. Thank you for doing this. I think it's very informative and helpful. As this gets rolled out for the first time, that's kind of a new option for providers that may be out of network. I had a couple questions. You mentioned that the IDR initiation needs to take place within 4 days following the close of the open negotiation process, or 4 days before the end of the open negotiation?
Following. So you tack on those 4 days. After the 20th day, you start counting.
Thank you. Second question is related to the determinations by an IDR entity and what information that IDR entity will be using to make a determination on the offers that have been submitted. So is there any guideline for the IDR to make a determination, or is it purely, what are the guardrails or guidelines that they will be going by in order to make a decision on which offer they select to make a final determination?
It's the same criteria that are set out under the Federal No Surprises Act. So there's no difference between the state and federal process in terms of the criteria for determining fair value. And it's fairly comprehensive, and we provide the opportunity for the provider to give information in support of the value of the services in the forms that we've created by listing some of those criteria in the forms. So, you know, the complexity of the service or the complexity of the patient's condition, the carrier's typical contract amount. There's a relatively comprehensive list of factors that are considered.
And those factors are in the proposed rules. If you want to click on that real quick. Do we have that? I don't know exactly where in the rules, but they're long rules, so look at the rules. But there is a section about the factors for determining. And they do mirror what's in the Federal No Surprises Act, not necessarily what's in the administrative rules that have been subject to a lot of litigation. So the process is made to look a lot like the federal process, but what we're trying to do at the state level is make it more streamlined and efficient and kind of avoid some of the pitfalls that have been plagued by the federal system. And all of that additional information, all the supporting documents is part of what would be submitted to the IDR entity with their offer, their proposed offer.
I would say if you're a provider and you're thinking about using the state process with regularity, then it'd be worth taking a look at the rule and that one section of the rule where the criteria are listed. And then, you know, you'd want to provide information that's relevant to those criteria.
And lastly, I think in the notice for this meeting, I think was circulated for the hearing at the Department of Insurance. It appears to be July 22nd at 2 o'clock.
Okay, so it did get scheduled. We're all
Oh,
in and
great.
out of the office
All
with
right.
vacation, so I knew it was in the works, but I wasn't sure if one had. We are scheduling a lot of rules hearings right now, so there's a lot of happening at the department. So
All right, so the hearing is July 22nd. Okay.
And you also afford the opportunity for comment a little bit past that.
Yes.
It's submitted, I think, this is July 29th.
Oh, thanks. Thanks for that update.
yeah, so our rules have been posted on the website, so I think we did already receive some initial feedback prior to initiating rulemaking, but you know, we're always happy to get more feedback.
Good. Well, it looks like we don't have any questions from our online participants. So that concludes our presentation. Thank you.